Hello, Medicos. Good day to all of you. So, this is Dr. BK for you, and in today's session of neuroanatomy, I am going to discuss about the lateral ventricle and the limbic system. So, these both structures are almost very close to each other, so that is why I have actually clubbed both of these two topics into this one single lecture. So the learning objectives for today will be with respect to the lateral ventricle, a short introduction, then followed by that I will be discussing about the situation, its parts, so mainly the various parts of the lateral ventricle, and followed by that the relations of the various parts, okay, its boundaries and relations of the various parts, and then the choroid plexus. So mainly all ventricles have a choroid plexus of capillaries which project into the ventricle, and then we will come as the second part of the lecture about the limbic system. So a short introduction about the limbic system, and followed by that various components of the limbic system, which we are going to discuss today in detail about the various components of the limbic system, and followed by that what is hippocampus and hippocampal formation, and then afferent and efferent fibers, so which forms the connections of the limbic system, and clinical aspects with respect to this, any lesions of the limbic system, what all clinical symptoms which we can encounter. So we will be discussing in this. So our learning objectives, which I have just listed now. Now we will actually proceed to the lateral ventricle. So here you are able to see a topographical representation of the ventricular systems of the brain. So here you are able to see the two lateral ventricles, and then in between what you are able to see is the third ventricle. So the lateral ventricles we communicate with the third ventricle, which is actually a cavity of the diencephalon. Okay, it is the midline cavity which is present in the midline. That is the third ventricle. The third ventricle actually communicates with the lateral ventricle through the interventricular foramen. Then posteriorly you can see the third ventricle continues as the narrow cerebral aqueduct or aqueduct of Sylvius, which is the cavity of the midbrain. Okay, and then you are able to see this dilated part as the fourth ventricle, which is the cavity of the rhombencephalon. So that fourth ventricle, roof of the fourth ventricle, we have discussed in detail. Fourth ventricle, so that floor and the roof and lateral recess of the fourth ventricle, we have lateral recess, median dorsal recess, okay, lateral recess and medial dorsal recess of the fourth ventricle, and actually it continues downwards as the central canal of the spinal cord. So the CSF actually which is produced in these ventricles, what happens is through the choroid plexus, because from the choroid plexus the CSF is actually filtered from the blood capillaries, and then it is secreted into these ventricles, and through the openings in the roof of the fourth ventricle, that is the foramen of Magendie and Luschka. Through this what happens, the CSF escapes and enters the subarachnoid space. So all these we have discussed in detail with respect even in the meninges class itself, introduction to neuroanatomy and meninges. Followed by that so many ventricles we have discussed about the fourth ventricle, then third ventricle. So finally we have come to the lateral ventricle. So the CSF thus produced from these ventricles and fills the cerebrospinal fluid. Finally, it has to again enter into the bloodstream. So that is through the arachnoid villi, which project into the superior sagittal sinus through arachnoid granulations, through which they are actually entering into the venous blood. So the CSF has so many functions. It also compensates for the lymphatic fluid because lymph nodes are actually absent in the central nervous system. So now coming to our lateral ventricle structure, it is the cavity of the telencephalon. So the large cerebral hemisphere. So it is the cavity of the telencephalon, or the cavity of the cerebral hemisphere, and it is a pad structure. So each cerebral hemisphere has actually this lateral ventricle. Two cavities are there on either side, and it communicates with the third ventricle, as I told you, through the interventricular foramen of Monro. So here you are able to see that interventricular foramen of Monro. So this should be your cavity of the lateral ventricle, which is again closed by a septum, which is called as the septum pellucidum. So if you just remove the septum, you are entering into the lateral ventricle. Okay, and this part you all know very well. It is the corpus callosum with the genu. This is your rostrum continuing as the genu, then body of the corpus callosum, and then the splenium of the corpus callosum. So the septum pellucidum separates the corpus callosum from one more white matter, band of white matter you are able to see, that is called as the fornix. So fornix is again the white matter of the limbic system, which we are going to discuss in this later part of this lecture. Okay, so I'm just introducing these terms. Not only that, any picture we see, naturally we should be able to identify. So again and again we keep on seeing these pictures and trying to identify the parts solves majority of the problem. So majority of the concepts you can very well understand by looking at the pictures, because that is the main strength of this subject, anatomy. So I advise all of you mainly to actually go and look at as many pictures, atlas or any textbooks for that matter. Okay, and also practice those diagrams, simple line diagrams you can practice, so that it saves a lot of time in the exam. You need not wait and draw and spend a lot of time, because if you are well versed in drawing diagrams, and that would help you a lot. And not only that, that also improves the presentation of your answer, most importantly. So any anatomy answer should be definitely accompanied by a diagram, especially your essays and short notes. So exempting the MCQs. So I think MCQs, it is not possible, no need to draw any diagrams. Okay, so that is your fornix, and below that you are able to see the thalamus, hypothalamus with the hypothalamic sulcus, that is your thalamic adhesion. And this is your pineal gland, stalk of the pineal gland. You have two peduncles, no, of the pineal gland, which you are able to see here, and that is the midbrain with the cerebral aqueduct traversing. So this should be your tectum of the midbrain. This is your tegmentum, and more anteriorly the crus cerebri, and this is the choroid plexus, which is projecting into the lateral ventricle. The choroid plexus here you are able to see that again. We will be discussing in detail in the later part of this lateral ventricle. So mainly the lateral ventricle communicates through the third ventricle through interventricular foramen of Monro. Okay, and this is your lateral wall of the third ventricle, because the other half of the hemisphere you will see the other wall. It is also the lateral wall. Okay, so there is no medial wall. Between the two lateral walls you have the cavity of the third ventricle. Now we are dealing with the mainly the lateral ventricle. So medially you are able to see the septum pellucidum, which separates the both the lateral ventricles from. So each hemisphere you have two lateral ventricles. So they are separated by this by this sheath of tissue which is called as the septum pellucidum. So roughly it is C-shaped. Okay, so it is C-shaped, and here you are able to see almost it is C-shaped, and it has got parts. Mainly this is the central part with its extensions. One which extends into the frontal lobe is called as the anterior horn. The extensions are called as horns, anterior horn, and extending into the posterior lobe is the posterior horn. Okay, so the central part of the body is in the parietal lobe, and you see an extension anterior horn into the frontal lobe, and the posterior horn into the occipital lobe, and inferior horn. So it is C-shaped with one extension below as inferior horn, one extension behind as the posterior horn, and one extension forward as the anterior horn. So central part, and you have anterior horn, posterior horn, and inferior horn respectively in the frontal, occipital, and temporal lobes. Okay, so here mainly you are able to see again the septum pellucidum has been removed. That is your corpus callosum, and this is your thalamus. So the septum pellucidum has been removed. Now you are able to see the cavity. Mainly this is your frontal lobe. So naturally you are seeing the anterior horn of the lateral ventricle. Now first we will discuss with the boundaries of the central part of the lateral ventricle. So which actually this central part extends from the interventricular foramen of Monro to the splenium of corpus callosum. Okay, so it extends from interventricular foramen of Monro to the splenium of corpus callosum is the extent of the central part of the lateral ventricle, the central part or body of the lateral ventricle. So what are the boundaries of this central part? Mainly, so roof is formed by the corpus callosum. So mainly your body of the corpus callosum forms the roof. So here you are able to see the roof, and then medial wall is actually formed by the what you are able to see. Medial wall is mainly formed by the septum pellucidum, which has been actually removed. Okay, so and the fornix. So below the septum pellucidum you are able to see the fornix. So the fornix lies intimately below the corpus callosum posteriorly, but as you proceed anteriorly both are separated. Your corpus callosum and the fornix is separated by the septum pellucidum. So the septum pellucidum and the fornix forms the medial wall. You are able to see a bulge. That is actually the floor part where you are able to see one nucleus. Only in the previous class I have discussed about this nucleus, the caudate nucleus, which you are able to see here. So that is mainly your head part of the caudate nucleus, and this is your thalamus. Thalamus is medial. Caudate nucleus head part will be somewhat medial, but slowly it passes slightly laterally, and then the tail part goes into the temporal lobe. Okay, so medial wall, septum pellucidum, and fornix, and roof is actually formed by the corpus callosum. So here you are able to see the central part or body, the cavity in a coronal section. So you know what is the section taken place, section taken at a coronal plane. So that is actually called as the coronal section. In the coronal section you are able to see the roof. So mainly the roof part will be formed by the corpus callosum, and medial wall is actually formed by the fornix and then the septum pellucidum. Fornix and then the septum pellucidum, which you are able to see here. Floor is formed by the caudate nucleus. So the previous picture I showed you the caudate nucleus. Here in the section again you are able to see the caudate nucleus, and this part is actually your thalamus and this is your lentiform nucleus. So the floor of the central part is mainly formed by the caudate nucleus and the thalamus. Okay, So these both are actually separated by two structures. So now you are able to see the floor of the central part, which consists of your caudate nucleus. So head of the caudate nucleus, as I told you, it is medial, but gradually it becomes slowly lateral, and what occupies the medial part is this mass of the gray matter, that is your thalamus. So what separates the caudate nucleus from the thalamus is your thalamostriate vein and stria terminalis. So here you are able to see a band of white matter which is called as the stria terminalis. So the stria terminalis is again mostly a fiber tract related to your limbic system. Mainly it carries fibers from the amygdaloid nucleus. Okay, so it is mainly carrying fibers from the amygdaloid nucleus and goes anteriorly to the septal area. Okay, so that is called as the stria terminalis, and along with that you are able to see one vein that is called as the thalamostriate vein. So your stria terminalis and the thalamostriate vein, both of them, they separate the caudate nucleus from the thalamus. So what you are able to see here is the floor of the lateral ventricle, the central part. So as you are able to see, it goes also downwards. This you are able to see is the inferior horn, and that should be your posterior horn into the occipital lobe, inferior horn into the temporal lobe. So it is a C-shaped cavity. Okay, so it is a C-shaped cavity, and this plexus is actually your choroid plexus. Okay, so the choroid plexus is actually the same for both single choroid plexus for the third ventricle. So now you are able to see this narrow slit in between the thalamus is your third ventricle through that narrow slit. So both the thalamus forms the lateral wall, and it is a midline gap. So there is no medial wall for the third ventricle. Okay, so that is about the floor of the central part of the lateral ventricle. So now coming to the remaining walls, anterior horn. So this is actually your anterior horn projecting anteriorly to the frontal lobe is the anterior horn, forward extension of the body of the central part. So mainly what are the structures forming the boundaries for the anterior horn? So your roof again formed by the corpus callosum and anterior limit of the anterior horn. So the anterior most end of the anterior horn will be formed by the genu of corpus callosum. The genu of the corpus callosum forms the anterior limb. You are able to understand, and the rostrum, and you are able to see the again the caudate nucleus forms the floor of the anterior horn. Okay, so the floor of the anterior horn is formed by the caudate nucleus which is lying on the floor, and the rostrum. So rostrum is almost become inferior, so these two form the floor, and you know what structure will be present here. The septum pellucidum forms the medial wall. So as I told you, anteriorly it is limited by the genu. Roof is formed by corpus callosum. Medial wall is formed by the septum pellucidum. Floor is formed by the caudate nucleus, and then your rostrum. So these are the boundaries of the anterior horn. So a coronal section of the anterior horn, you are able to see here, mainly the floor is formed by the caudate nucleus. Okay, so mainly the floor is formed by the caudate nucleus. Okay, and then anteriorly it will be limited by the genu of the corpus callosum, and floor, roof is formed by the corpus callosum, and anterior most end it will be the genu of corpus callosum. You are able to see that. Okay, this is your medial longitudinal fissure, and in the depth of the fissure only you are able to see the corpus callosum. So that is your anterior horn of the lateral ventricle, floor by the caudate nucleus. Okay, and now coming to the other parts, posterior horn extends into the occipital lobe. So here you are able to see the posterior horn. So a coronal section cut across along the coronal plane in the occipital lobe, you are able to see that is your uh, posterior horn of the lateral ventricle extending into the occipital lobe. So that also has got a roof, a lateral wall and then a medial wall. So it has got a roof, lateral wall and a medial wall. So which forms the boundary. So the roof and lateral wall is the tapetum fibers from the splenium of corpus callosum. So what are actually these tapetum fibers? So you know the fibers above, you are able to see the corpus callosum. So the white matter band of fibers, they run on either side from the midline. So the anterior most fibers, they curve and they are called as the forceps minor. Posterior fibers, they curve and called as the forceps major. Mostly the fibers from the splenium, posterior part of the corpus callosum, when they travel laterally, you know, some fibers are descending. Uh, they are perpendicular to these fibers of corpus callosum, and that is your internal capsule. So from corona radiata, the internal capsule is passing between your lentiform nucleus laterally and caudate nucleus and thalamus medially. So these fibers will go to the brain stem. So naturally there is intersection of these transverse fibers of the corpus callosum and the vertical fibers of the internal capsule. But as you come more posteriorly near to the splenium, these fibers are not at all interrupted by the fibers of internal capsule. So these fibers form the tapetum fibers, which is from the splenium, because you have come near to the occipital lobe. So naturally the roof and lateral wall is formed by the tapetal fibers, which are not interrupted by the descending or ascending vertical fibers, which mainly they are the fibers of the internal capsule, white matter, projection fibers. Okay, finally, not finally, coming to the mainly the other boundaries, medial wall, you see two elevations. Okay, so two bulges or elevations you are able to see. So the first elevation is actually called as the bulb of the posterior horn of lateral ventricle. Bulb of the posterior horn of the lateral ventricle. So what are these fibers? So the fibers which are sweeping, which is sweeping from the splenium like fork like, that fibers we have seen, no, the forceps major fibers. So those fibers which are sweeping to the occipital lobe from the splenium, they produce a bulge on the medial wall of the inferior horn, and it is called as the bulb medial wall of the posterior horn. So it is called as the bulb of the posterior horn of the lateral ventricle. And below that also you are able to see one more impression, and that is called as the calcar avis. Okay, so that is actually called as the calcar avis, which is formed by the calcarine sulcus. So in the medial wall, medial surface of the occipital lobe, sulci and gyri, you would have seen the calcarine sulcus. So along the lips of the calcarine sulcus only you have the area 17 and 18, the primary and the secondary visual areas. They are situated around the calcarine sulcus. So this calcarine sulcus is actually a deep, they are actually deep sulcus, limiting sulcus, which produces an impression on the medial wall of the posterior horn, and that is actually called as the calcar avis. So it is the impression which is pushing the white matter. So that what happens is that calcarine sulcus is pushing the white matter deeply, and which is forming a bulge on the posterior horn of the lateral ventricle. Okay, so two things on the medial wall of the posterior horn. One is the bulb of the posterior horn, and other one is actually the calcar avis. Next, coming to the inferior horn. So here you are able to see that is the inferior horn. So this is your central part or the body, and then that should be your anterior horn. So the anterior horn, and that should be your posterior horn. On the medial wall of the posterior horn, you are able to see the calcaire avis. Okay, that impression. Now the inferior horn extends into the temporal lobe. So from the body it runs downwards and then forwards into the temporal lobe. Okay, and you're able to see what is extending in the central part and also on the inferior horn is your choroid plexus. Okay, so the choroid plexus is related to the floor of the central part of the body, but then along the inferior horn it is related to the roof of the inferior horn. So I will come to the choroid plexus a little later. So the roof actually what happens slopes as the lateral wall for the inferior horn, and again it is formed by the tapetum fibers. So these fibers which you are able to see here, no, this corpus callosum. So the fibers from the splenium, the expanded part, they actually run and slope laterally, form the roof and then slope laterally for the tapetum fibers. Roof slopes downwards as the lateral wall. Okay, so then coming to the near the roof, on the roof of the inferior horn, you are able to see the caudate nucleus continues downwards from the floor of the central part and anterior horn. It continues and the tail of the caudate nucleus you are able to see in the roof, and what is attached to the anterior most end of the tail is the amygdaloid body or amygdaloid nucleus. Okay, and closely related with this amygdaloid nucleus is the stria terminalis. Okay, so that is the fibers mainly from the amygdaloid nucleus travel via the stria terminalis. We have already seen the stria terminalis on the floor of the central part, which separates the caudate nucleus from the thalamus. Stria terminalis and the thalamostriate vein, no, which we have already seen in the floor of the central part of the lateral ventricle. So that stria terminalis, tail of caudate nucleus and amygdaloid nucleus we are seeing in the roof of the inferior horn. So all these structures continue from the floor of the central part, and as I told you, you have the amygdaloid body attached to the tail of the caudate nucleus. Okay, so next coming to the floor of the inferior horn. So you are able to see the floor structures. Mainly what you see is the hippocampus. You are able to see. So that is the hippocampus, a bulging on the floor of the inferior horn. In the temporal lobe, you are able to see that bulged structure is the hippocampus, and mediated medially the sheet of white matter, thin white matter, is actually called as the alveus, which continues as the fimbriae. Okay, so all these are actually situated on the floor of the inferior horn. So that is a sheet of white matter immediately medial to the hippocampus. So this is the hippocampus which you are able to see here, and medial to that is your mainly I told you the alveus, and then it continues as the fimbriae. The fimbriae, if you trace it above, it will continue as the fornix. The fimbriae will actually continue as the fornix. So that is the hippocampus and your fimbriae of the hippocampus, which you are able to see here. Okay, so it is nothing but the efferent tract, the fimbriae and the alveus fimbriae, and then the fornix are nothing but the efferent pathway of the hippocampus. Okay, so next actually coming to the collateral eminence. So more laterally you will see this collateral eminence, which is produced by the collateral sulcus. Okay, so the impression produced by the collateral sulcus is the collateral eminence, which you are seeing lateral to the hippocampus in the floor of the inferior horn of the lateral ventricle. So we have discussed about the boundaries of the various parts of the lateral ventricle. So that is mainly your central part we have seen, and then we have seen the anterior extension, anterior horn, and then we have seen the posterior horn, and just now we have seen the inferior horn. So now coming to the tila choroidea and choroid plexus. So tila choroidea is already, as we have discussed in the other ventricles, it is a double layered fold of pia mater. So which projects from the midline actually it projects laterally the tela choroidea. So when the pia mater invaginates from here, it is going to invaginate laterally. Along with it, it will bring a capillary plexus which is called as the choroid plexus. Okay, so these two, tela choroidea and choroid plexus, will be actually separated from the cavity by the structures lining the interior of the cavity, the ependymal cells. So the tela choroidea and choroid plexus, if you look at it, it will be lined by the ependyma. So it is a specialized type of neuroglial cells. Okay, so here you are able to see that tela choroidea with the choroid plexus, they enter the lateral ventricle through the choroid fissure. So where actually this choroid fissure is actually present between the fornix above and the thalamus below. Okay, so here you are able to see the fornix and the thalamus. So between these two, we have the choroid fissure through which the tela choroidea along with the choroid plexus will enter into the your lateral ventricle, mainly the central part of the lateral ventricle. So the fissure is below the fornix in the central part and above the hippocampus in the inferior horn. So as I told you in one of the previous picture also, I told you in the central part it is below the fornix, near the floor, but in the inferior horn of lateral ventricle it is nearer mainly to the roof. So that is above the hippocampus. So here you are able to see the choroid plexus in the central part because this is your anterior horn. So it will be present below the fornix, but above the hippocampus on the inferior horn. Yes. So that is the choroid plexus which is projected. So you are able to see below the fornix in the central part, but above the hippocampus on the inferior horn. So this is your hippocampus which you are able to see on the inferior lobe, temporal lobe. Okay, so that is the choroid plexus, how it is situated. Now if you carefully look at the choroid plexus, it is common for both, as I told you, the third ventricle and the lateral ventricle. Okay, so it is T-shaped and it has got two lateral limbs which are actually projecting into the which are actually projecting into the lateral ventricle, and it has got a vertical limb, two sides paramedian in position, which is actually present in the third ventricle. So it is common for both lateral as well as the third ventricle. So the lateral edges, they project into the central part of the lateral ventricle, and four in number, 1 2 and this 1 2, two vertical, and actually you are able to see two horizontal and two vertical plexus. So in the midline, as I told you, it is for the it is mainly for the third ventricle. So four choroid plexus are to be seen. Okay, so they lie along the lateral margins and as I told you, project into the corresponding lateral ventricles. Okay, so then you are able to see enter the central part and they continue to the inferior horn. So in the inferior horn, you are able to see the choroid plexus. So in the past picture only I showed you how actually it is present above the hippocampus. So you are able to see the hippocampus. So above the hippocampus, you are able to see the choroid plexus in the inferior horn of the temporal lobe. So mainly in the central part, it is the capillary plexus is derived from the posterior choroidal artery. So posterior choroidal branches. Okay, whereas in the inferior horn, it is this choroid plexus which you are able to see, it is mainly from the anterior choroidal artery. Okay, so that is about the tela choroidea and the choroid plexus of the lateral ventricle. So applied aspects, clinical aspects mainly. So any obstruction of the lateral ventricle will lead to hydrocephalus and also increased intracranial pressure. So that is one thing, and it can be done through ventriculography to diagnose any block in the ventricles. You do a procedure called as the ventriculography. So air is actually injected mostly as the contrast medium with respect to the ventriculography. So I have completed the lateral ventricle, and now we will move on to the limbic system. So now actually we have come to the limbic system. So what actually is the limbic system? Usually there is a general notion that limbic system is somewhat very complicated and it involves many structures and all those things. So not such much complicated as anticipated. So it is only a general fear among the students that limbic system is one of the complicated topics in the neuroanatomy. So I will try to keep it as simple as possible. So limbus means ring. So you're able to see a ring of structures which are all highlighted in various colors: green, yellow, blue, and then this is violet. No, so these are all you are able to see they are situated like a ring like structures, and that is why the term limbic system. Okay, so they where actually they are situated above the brain stem. Okay, so they are situated mainly above the brain stem, so along the upper end of the brain stem, and that is why it is called as the limbus or ring. It consists of both the cortical as well as the subcortical structures. Okay, so subcortical means you should remember mainly any term with respect to subcortical means below the cortex. That means deep to the cortex. So subcortical mass of gray matter we have seen in the previous class only, your basal ganglia. So in this the amygdaloid is a subcortical structure, definitely that is involved. And nuclei, so mainly there are certain nuclei. Subcortical means immediately you think of certain nuclei. So whenever you get stuck somewhere, you don't know what is subcortical, which is not coming into your mind, is the nuclei, which is situated deep to the cortex in the cerebrum and also below the cerebrum. So immediately below the cerebrum, definitely it is a mass of gray matter. No, your thalamus, your hypothalamus, and concerned with that your mammillary body, habenular nucleus. They are all again subcortical matters only. So cortical and subcortical. So cortical mainly with respect to limbic system. Of course, it projects to many different areas. One thing you are able to see this area, so very wide area of the cortex, which you are able to see here. So this should be your cingulate gyrus. So again, when respect to the cortical part of limbic system, what should come to your mind is your cingulate cortex, and also some other cortical matter which is situated here, that consists of your olfactory cortex, so entorhinal area and piriform cortex. So that part I am not going to into much detail about the olfactory cortex. I've just very touch upon the olfactory cortex, certain structures. Okay, so this limbic cortex is classified under the archy cortex. So neocortex, paleocortex, and then what you have is the archy cortex, the oldest cortex. Okay, so oldest cortex means definitely it is the related to the olfactory region. You're able to understand. So the olfactory system, mainly the olfactory system, many of these areas initially, these limbic areas, what I have shown, no, the cortical and subcortical, they were initially thought to be predominantly olfactory in function. So that is why they are actually classified here. But what happens is now they have found out its other functions, not predominantly olfactory. It has some connections with the olfactory cortex, but the other main functions are mainly your emotional behavior. That is one thing. Then memory, especially your recent memory. So these two, some of the main functions are these two, which can be enumerated as per functions of the limbic system, and also integrating your responses, mainly your visceral responses. Okay, and acting according to it. So your somatic and visceral responses are actually integrated with your olfactory, and then what happens? You act according to it, or you react according to it. So that is one of the functions. So first of all, it is considered under the archicortex, oldest cortex. Paleocortex, one good example is your globus pallidus, whereas the remaining part of your cortex, no, your sensory motor olfactory, not the olfactory, your sensory motor cortex, prefrontal area, all those things are neocortex. Now, if you take the archicortex, usually you will have only 3 layers of the cerebral cortex, whereas the other neocortex, you will have 6 layers. This can be appreciated only histologically. Okay, so there will be 6 layers, such as your pyramidal cell layer, granule cell layer, layer of polymorphic cells. So like that you will have mainly 6 layers, but this archicortex has got only 3 layers, and it is also called as the mainly your allocortex. So previously it is termed as rhinencephalon because of its close proximity to the olfactory. The olfactory area or the olfactory sensation is the most primitive sensation, and it is from the older forms. What happens, it is been evolved, but in humans, this olfactory sensation has become somewhat vestigial than the other animals, because olfactory sense in lower animals is actually very much what do you call functional, and to detect its prey, mainly to detect its prey. Not only that, to also detect any danger, to detect its partner. So for all these things, the olfactory sensation is used in the lower forms. But we as humans, what happens, our sensory motor cortex, neocortical area, has developed enormously. So thereby we use the other parts of the cortex for survival. But that doesn't mean that this part of the cortex we are not using. But again, for survival, this part is very essential and necessary. Okay, so it is made up of 3 layers, and that is why it is also called as the allocortex. So some ring of tissues which are both cortical and subcortical in location. So we will go into those details of this. So the final components of the limbic system, we will just try to first list out the functional. Once you understand where all these structures are present, that itself solves half of your problem, makes things matters easy. So the cortex, or the cortical part of gray matter with respect to limbic system, includes all these areas which you are able to see here. So we will try to enumerate this one by one. So mainly the limbic lobe. Okay, so here the limbic lobe and the hippocampal formation, which is present deep here to the parahippocampal gyrus and uncus. Deep to that you have the hippocampal formation and the limbic lobe. So this is the cortical part. So what are the parts forming the limbic lobe and the hippocampal formation? That we will see in a short while. So the limbic lobe mainly includes. So now coming to it, the cingulate gyrus. As I told you, just now in the previous slide, I told you whenever cortical part of limbic system, what should come to your mind is your cingulate gyrus. Then isthmus. So here we are able to see the parahippocampal gyrus is actually connected to the cingulate gyrus through a strip of cortex that is called as the isthmus. Okay, so there you have a gyrus which is also called as Gyrus Fascularis. So I will come to it later. So now cingulate gyrus, isthmus, and then the parahippocampal gyrus. Okay, so here the parahippocampal gyrus again anteriorly forms a hook-shaped structure that is called as the uncus. Okay, so this is your parahippocampal gyrus. As I told you, the hook-shaped structure uncus. So they all actually form a continuous ring, no? So that is why they are the cortical parts. They are the cortical gray matter of the limbic system. Subcortical gray matter as I told you, when is subcortical means you should immediately think about the nuclei. So what are all the nucleus which are actually involved in the subcortical nucleus involved in the limbic system? So structural components. So here you are able to see certain parts are actually highlighted for you. So mainly the subcortical part, you should think about this amygdala. So amygdaloid body. So it has got a very important functions, even though it is very small part situated or attached to the tail of the caudate nucleus. So we are going to discuss about the amygdala in detail. The next next to amygdala, what you have is the septal region and the septal nuclei. So here you are able to see. So septal means don't think about the septum pellucidum. So here you have the septal region and the septal nuclei. So I will come to that also in detail, because one by one we are going to discuss. So that is the septal area. Deep to that you have the septal nuclei. And then what else you have? The olfactory area or the piriform cortex. Okay, so your olfactory tract and your olfactory striate. So all those things are present in near the olfactory area. Then your hypothalamus, mainly consisting of your mammillary body. Okay, so your hypothalamus with the mammillary body mainly. Okay, and then thalamus also contributes, mainly your ventral or anterior nucleus of thalamus. So these are all the subcortical gray matter which is involved in the formation of the limbic system. So this subcortical and cortical. Cortical, as I told you, cingulate gyrus, like a ring you trace it, it comes mainly as your isthmus parahippocampal gyrus and uncus. Subcortical mass of gray matter includes mainly your amygdaloid, septal region and septal nuclei, mainly then hypothalamic nuclei, mammillary body and ventral nucleus of the thalamus. Okay, so these are the components of the limbic lobe. I have not discussed about the hippocampal formation. So I will come to the hippocampal formation after we discuss about mainly your amygdaloid body and the septal region, because hypothalamus and thalamus we have already discussed in detail in the diencephalon. So now coming to the amygdaloid body. So where actually it is situated in the temporal lobe. So near to the temporal pole, a small almond shaped mass of gray matter. So deep to the parahippocampal gyrus, you are able to see the amygdaloid body or amygdaloid nucleus. So this amygdaloid body, which we have seen the roof of the inferior horn, no, attached to the anterior end of the tail of the caudate nucleus. This amygdaloid body or amygdaloid nucleus, it is a nuclear complex. Okay, so it has got many subdivisions like lateral, medial, basal, central, and perilamina. So I am not going into those what do you call the subdivisions. Okay, so mainly it is attached to the tail of caudate nucleus in the inferior horn. All this we have seen before itself. So afferent fibers, mainly the afferent fibers, you are able to see your olfactory bulb, olfactory tract, medial and lateral olfactory striae. So afferent fibers are mainly from your olfactory tract or olfactory, primary olfactory region. Okay, then what else? From the locus ceruleus. So from the locus ceruleus, it mainly receives noradrenergic fibers. Okay, and serotonergic fibers from the raphe nuclei, reticular formation. Okay, then it will also receive mainly dopaminergic fibers from the this is your hypothalamus, so the midbrain. So from the midbrain, ventral tegmental, then there from the ventral tegmental area, it will receive dopaminergic fibers. So serotogenic fibers, noradrenergic fibers, and then what else? As I told you, the dopaminergic fibers it receives. Okay, then what else it receives? Apart from that, it sends efferent fibers. So the efferent fibers whenever you think of the efferent fibers, the main pathway is through the Stria Terminalis. So one is actually through the Stria Terminalis, the efferent pathway. The other one they tell is actually the ventral amygdalofugal fibers. So that is the fibers which are actually radiating from the amygdala, radiating from the amygdala to the various regions, the amygdalofugal fibers. Okay. Now first let us see the efferent fibers is mainly to the Stria Terminalis. We have already seen this Stria Terminalis in the lateral ventricle. So we have seen it separates the caudate nucleus and the thalamus in the floor of the central part. Then also on the roof we saw the Stria Terminalis continuing downwards along with the caudate nucleus. So very closely related to the amygdaloid nucleus, the Stria Terminalis. Okay, so this Stria Terminalis is what do you call? It is actually the fiber of connect the efferent fibers of the amygdaloid. Okay, so the Stria Terminalis is a bundle of fibers, mainly the efferent fibers. Now it actually what happens is forms the efferent pathway seen along the medial part of the caudate nucleus and pass along the roof of the inferior horn and then floor of the central part of the lateral ventricle. So you are able to see it is passing along the floor of the central part of the lateral ventricle and seen between the caudate nucleus and thalamus. This relation already I told you. Near the interventricular foramen, the Stria terminalis is actually dividing and some fibers they terminate into the septal region. So that septal nuclei you are able to see in the septal region, septal nuclei. So there they actually go and terminate. So that is the Stria terminalis forming the main efferent pathway of your amygdala. And here it is closely also related to the fornix. Okay, so efferents of amygdala from the amygdala are actually sent to hypothalamic nucleus. So one actually from the amygdala they project to the hypothalamic nucleus. Okay, then to where all it projects apart from the hypothalamic nucleus to the median dorsal nucleus of thalamus. So here you are able to see the median dorsal nucleus of thalamus. To there it projects the amygdala. Then to the hypothalamus. This is your Stria terminalis going again to your septal region. So one efferent to the hypothalamus, medial nucleus of dorsal nucleus of thalamus. Then other efferents it will actually project to the nucleus of tractus solitarius, gustatory information. Okay, and to the dorsal nucleus of vagus. So again these two connections are very important. Then via the anterior commissure. So here you are able to see the anterior commissure in the lamina terminalis. Through this to the opposite amygdala. So this has connections with the amygdala of the opposite side through the fibers passing through the anterior commissure. Then to the habenular nucleus. So here you are able to see that is your habenular nucleus via the stria medullaris thalami. So fibers actually connecting the hypothalamic nucleus with the habenular is actually stria medullaris thalami. And to corpus striatum, especially the ventral striatum. So I told you that the anterior part of the ventral striatum you have certain nucleus called as the nucleus accumbens and the zona incerta. So to that it actually connects. So it indirectly influences the pallidum. The amygdaloid nucleus have a indirect control over the pallidum because from the corpus striatum it will project to the pallidum. Okay. Then to the neocortex, mainly to the frontal, parietal and actually the occipital cortex. And here we should not forget about its connections to the cingulum. So to the cingulate gyrus also it actually sends fibers. Okay, so cortical connections, they are actually called as the cortical connections. Numerous connections with the widespread area, frontal, temporal, occipital and mainly your cingulate gyrus. Okay, and then as I told you to the nucleus solitarius and dorsal nucleus of vagus. So now from here it receives fibers and again it sends fibers to the nucleus solitarius. So this from the taste sensations, nucleus solitarius, dorsal nucleus of vagus mainly carries most of your visceral sensations. So that all your visceral sensations, taste sensations are all integrated, and I told you it has connections mainly different from the olfactory. So it actually integrates those with the olfactory stimulus. Okay, so here you are able to see the other connections mainly. Okay, so mainly to the anterior cingulate gyrus as I told you, and then to the ventral striatum nucleus accumbens. So it goes to the ventral striatum. Okay, so these are all the efferent fibers. So very wide efferent areas, mainly the most what do you call, the major pathways to the stria terminalis. Okay, so mainly it is smell mediated sexual behavior. Sexual behavior mediated through olfaction. So that is why it is mainly afferents from the olfactory region. So one of the main function of the amygdala. Then somatic response to internal needs, as I told you, no. So it actually integrates your visceral responses and also your body somatic responses with its connection with the hypothalamus. So your hypothalamus has got all your satiety center, um, okay, your hunger center, then also you have your temperature regulation, circadian rhythm. So all these things. So on basis of all connections, it appears that amygdala plays an important role in emotional behavior. Okay, so through the dorsal nucleus and gustatory, it also brings about cardiovascular and respiratory function. So you increase in heartbeat, increase in respiratory rate, pupillary dilatation in response to certain visceral responses. Okay, so it can bring out mainly during certain emotions, your heartbeat increases, your respiratory, you have your respiratory rate increases. So all this is mediated by this amygdala, and as I told you, it is concerned with emotional behavior. So that is these are the main functions. And so when the amygdala is stimulated experimentally, so it produces fear, rage and excitability. So all this is mainly concerned with your emotional responses. Okay, so that is why what happens if the amygdala there is a lesion, then the person will not be able to evaluate uh, his environment, and he won't be able to react appropriately to his surroundings. So there will be definitely alterations, especially in his sexual behavior as well as mainly his eating behaviors. So now coming to the septal region. So this region is actually called as the septal region, which is present anterior to the lamina terminalis and anterior commissure. Okay, so lamina terminalis and anterior commissure, you are able to see mainly two vertical sulci you will be able to see here. They are called as the para-olfactory sulci. Okay, so they are called as the para-olfactory sulci. So anterior and posterior para-olfactory sulci. So between the anterior commissure and posterior olfactory sulci, this area will have your mainly the para-terminal gyrus. So and then between and you have the pre-hippocampal rudimentary in front of this posterior para-olfactory sulcus, and between the posterior and anterior para-olfactory sulcus you have the subcallosal area. So the subcallosal area and your paraterminal gyrus all comes under the septal region, and deep to the septal region what you have is the septal nuclei. Okay, so the septal nuclei is actually present deep to the septal region. So I told you septal nuclei, and that is your subcallosal area, so which is present between the anterior and posterior para olfactory sulcus. Okay, so afferents mainly from the olfactory tract, amygdala and from the hippocampus. So this is your hippocampus, from the amygdala and from the medial olfactory tract. So you're able to see, So mainly connections olfactory through the medial olfactory striae, it is entering. Then from the amygdala through the Striat Terminalis, it is actually projecting into the septal area. And from the hippocampus through these fibers, Fornix also, it is actually projecting into the what do you call the septal area, which consists of the septal nuclei. So efferent connections from the septal nuclei, efferents, they mainly go to the the habenular nuclei through the stria medullaris thalami. So this is your stria medullaris thalami. Now from the hypothalamus, it projects to the habenular nuclei through the stria medullaris thalami. So this is your habenular nucleus. So main efferents to the habenular nucleus, it projects. So efferents to habenular nucleus. The main function, it is actually your pleasure zone. So what happens? Your pleasure and any rewardness is actually recognized in this area. So its stimulation of this zone reduces your aggressiveness. Okay. So that is about the septal region. Now passing on, we have completed the cortical structures. He Singulate Gyrus, and then the isthmus, what we have seen, that Gyrus Fascularis. Okay, and then the para-hippocampal gyrus and uncus, cortical. Subcortical, we have seen mainly the amygdala and the septal nuclei. Other parts, mammillary body, hippocampus, we have actually hypothalamus. We have discussed hypothalamus and thalamus. Okay, in the diencephalon. Now coming to the hippocampal formation. So gray matter of the hippocampal formation include the hippocampus. Okay, along with one gyrus which is called as the dentate gyrus. So that is one structure, hippocampus with the dentate gyrus. And then you have the para-hippocampal gyrus and indusium griseum and medial lateral striae, Gyrus Fascularis. Okay, so the Gyrus Fascularis will be seen here, also called as the splenial gyrus, Gyrus Fascularis. Okay, and then so here you are able to see on top of the corpus callosum, that is the indusium griseum, and on the indusium griseum you come across the medial and lateral longitudinal striae. So they are actually displaced part of your hippocampal formation, limbic system. Okay, so they usually, what happens is, it should have been below in the temporal lobe, but how they have displaced? Because the corpus callosum is actually intervening. So that is why this part of this hippocampus, which should have been here, has gone above because of the development of the corpus callosum. The indusium griseum, medial and lateral longitudinal striae are all actually displaced above because of the development of the corpus callosum. Okay, so otherwise it is a she-shaped structure around the lateral ventricle. Okay, so they have got displaced because of the corpus callosum, just now I told you. So now coming to the hippocampus or hippocampal formation, in a coronal section, you see it looks like a seahorse. So the name hippocampus means it is actually a seahorse. So seen in the inferior horn of the lateral ventricle. So mainly what happens is, it was usually present here but has been pushed medially. It has been pushed medially or deeper due to this neocortex which has developed, and because it is pushed inside, it has formed a sea lion like structure that is actually called as the hippocampus. So it is S-shaped, and medially you are able to see it is by the tela choroidea of the inferior horn of the lateral ventricle. So the tela choroidea forms mainly the medial septum, medial limit of the hippocampus is formed by the tela choroidea. Okay, so it is S-shaped, and you are able to see these are the parts of the hippocampus. So the upper limb of the S, you are able to see the upper limb of this is called as cornua ammonis. Okay, it is actually called as cornua ammonis or Ammon's horn, which means ram's horn. So it represents like a ram's horn. Ram means sheep, one sheep. So another name for ram's sheep. So like a sheep's horn, it is called as cornua ammonis. Then the inferior limb is mainly formed by the para-hippocampal gyrus. The inferior limb is actually formed by the para-hippocampal gyrus. So the intermediate area connecting the cornua ammonis and the para-hippocampal gyrus is actually called as the subiculum. So the middle limb connecting the excuse me, upper and the lower limb is actually called as the subiculum. Okay, so this is the hippocampal formation. On total it appears like a sea horse. Okay, and so it is on a coronal section only you come across, not on a cross section or a transverse section. You won't see such a type of arrangement. So now this hippocampus you are able to see now in a, now you are seeing not a coronal section but a transverse section, especially which has opened the inferior horn of the lateral ventricle. On the floor of the inferior horn you are able to see the hippocampus bulging onto the floor of the lateral ventricle, and anterior most part of the hippocampus you are able to see it is somewhat ridged, and it is called as the spes hippocampus. Paw, so like your dog's or cat paw, no? So like that with the fingers, toes on the digits. So like that it appears. So that is why it is named as the pes hippocampus, the anterior expanded part. So on the upper surface of the hippocampus, you are able to see thin sheet of white matter called as the alveus. Okay, so the thin sheet of white matter is actually called as the alveus, and that continues as the fimbriae. So the alveus forms a bundle which is called as the fimbriae, and the fimbriae is actually continuous as the fornix. So you are able to see the fornix. The fornix now, this will form the roof. Okay, the fornix. Okay, then both the fornix will be connected together by the commissure of the fornix. So thereby one hippocampus is connected to the contralateral hippocamper by the commissure of fornix. So one type of commissural fibers. Okay, so that is your fornix, which the fornix will again divide into anterior column of fornix. Okay, so that is the main efferent fibers of the hippocampus is the fornix. So alveus, fimbriae, and then fornix. Medial to the hippocampus, you are able to see some tooth-like structures that is actually called as the dentate gyrus. So it is elongated strip of gray matter and situated medial to the Ammons horn, the anterior most part of the hippocampus. So the medial end from these gyrus only, what happens? The what do you call the fimbriae starts, the alveus and the fimbriae. So continues as the tail and continues with the gyrus fasciolaris. So you are able to see that is the fasciolar gyrus or the splenial gyrus it is called as. So the dentate gyrus, the tail of the dentate gyrus and gyrus fasciolaris, which you are able to see here. So from the medial end of the dentate gyrus only you are able to see the fimbriae arises, as I told you. Okay, and alveus anteriorly you can see the fimbriae will cover a thin layer of white matter on the hippocampus called as the alveus. So your hippocampus mainly receives afferent fibers, connections of the hippocampus mainly from your entorhinal area. So this entorhinal area mainly it receives afferents and from amygdaloid. So very closely it is related to the amygdaloid nucleus and also from the cingulate gyrus. So it receives fibers from the cingulate gyrus. It also projects fibers to the cingulate gyrus, and through the contralateral opposite hippocampus via the commissure of fornix. So efferent fibers, main efferent fiber is through the fornix. The fibers leaving the hippocampus pass via the fornix to the opposite hippocampus, mainly through the commissure of fornix. I have already shown in the previous picture how the two fornices are connected. Then to the septal nuclei and mainly to the anterior part of the hypothalamus tegmentum of midbrain through the anterior column of fornix. Okay, so that is actually your anterior column of Fornix. Okay, then to the habenular nuclei through the stria medullaris thalami. So that is your habenular nucleus, mainly through the stria medullaris thalami, which you are able to see here. From here, the hippocampus, actually anterior column of Fornix, from there it will project to the habenular nucleus via the stria medullaris thalami. Then to mammillary body through the mammillothalamic tract, because not directly to mammillary body, it will actually project mainly to the ventral nucleus of thalamus, and from there it projects to the mammillary body to the mammillothalamic tract. So that is the mammillothalamic tract to the mammillary body. Okay, so main efferents, as I told you, to the opposite hippocampus, septal nuclei, anterior hypothalamus, via the stria medullaris thalami to the habenular nucleus to the mammillary body through the mammillothalamic tract. Okay, so from thalamus to cingulate gyrus, and that is actually called as the Papy's circuit. So the Papy's circuit mainly again it is concerned with the recent memory. So from the hippocampus via the fimbriae fornix, mammillary body, then anterior nucleus of thalamus. Okay, that is for the mammillothalamic tract. From the anterior nucleus of thalamus, it projects to the cingulate gyrus, and cingulate gyrus again projects to the hippocampus. This is actually called as the Papy's circuit. Okay, so fibers actually from the cingulate gyrus to the hippocampus, and hippocampus again to the cingulate gyrus forms a circular circuit like neuronal connections, which is called as the Papy's circuit. So mainly integration of olfactory, visceral and somatic sensations. So which is mainly responsible for a survival of the species, that is the organism. Okay, so survival mainly consists of your procuring the food and what else? Definitely your eating behavior. So procuring food in older in actually what happens in the lower forms, how it hunts its prey or go for food. So that animal instinct still has humans. We have that animal instinct. Okay, so definitely we all mainly that is what no for survival we have to procure food for our survival, but now we call it in a different names, like we go for job, this that salary, but ultimately it is actually the mainly for procurement of food. But after that what happens, we have diversified so many things of luxuries, but our primitive thing for survival is procurement of food, our eating behavior, and then our sexual behavior, because reproduction, sexual is again one of the what do you call survival activities, and naturally the species does not evolve without the reproduction. It actually what happens, the whole species is actually what do you call it's destroyed if there is no reproduction. So that limbic system is mainly concerned with your recent memory. Okay, so the hippocampus mainly CA1, CA2, CA3 regions and the dentate gyrus are all mainly concerned with our learning. Okay, so recent memory. So these two are accomplished by the Papy's circuit, as I told you, our emotional behavior and the recent memory. Then activities for survival such as procuring food, eating and sexual behavior I already told you. So coming to the clinical aspects, finally concluding. So acute amnesic syndrome, unable to process short term into long term memory. So this is actually amnesia, we call it as mainly lesions in the hippocampal formation, limbic system. So general basic things they will have in the memory, but the new things or recent memory mostly they are lost. Alzheimer's, degenerative disorder, especially in elderly persons, there is loss of short-term memory, but as the disease progresses, what happens? Long-term memory is also lost. So to prevent from Alzheimer's disease, the best thing what we should do is keep our brain always active in a healthy way. So not simply looking into the cell phone, mainly reading new things. Okay, and reading new things, solving puzzles, some analytical problems like that we try to solve. Naturally, when we keep our brain actually active, then naturally we can postpone the setting of Alzheimer's, because otherwise mostly when we tend to lose neurons as age advances, there is a fair chance of these Alzheimer's disease to set in. So schizophrenic, so persons, we call them a schizophrenic, disordered thinking, absence of emotional response. So they don't emote or appropriate emotions. They have anxiety, depression, and fear, mainly this schizophrenia. Then amygdaloid nucleus or bilateral temporal lobe lesion leads to this Kluver-Bucy syndrome. So changes in eating behavior, abnormal sexual behavior, and loss of fear and anger is seen in these type of persons. Okay. So with this, I have concluded the limbic system, and thank you very much for your patient listening.